Danger signs of pregnancy. If you're a girl or a woman or a lady that is pregnant, please come closer. These signs I'm going to mention, you need to pay close attention to them if you are pregnant. If not, it can lead to child mortality, death, or maternal mortality, death. Okay, one is severe headache. If you're having severe headache, well, in the course of your pregnancy, that 9 months of being pregnant, you need to go to the hospital, especially when it's accompanied with blood vision. You're not seeing properly. My sister, it could be sign of preeclampsia, which is fit during pregnancy and is not good. It can lead to death of the mother or the child. And that one is swelling. If you're having puffy face, your hands are swollen, your legs are swollen more than it should swell. Yeah, yes, at the later stage of pregnancy, the legs swell, but that one is normally that one is normal. But if it's extreme, you need to go to hospital. It can still be sign of preeclampsia, where your protein, you need to go and check where your protein is high. You're having high proteinuria, and you're having high protein, or your BP is high. It can make you to have preeclampsia or eclampsia. It's not good. So you need to go to the hospital early if you are noticing this sign. And that one is bleeding. If you are bleeding normally in the initial 3 months of pregnancy, you have spots, normal spotting that is not really much. There is not really much, the blood is not much. But at the earliest stage of pregnancy, you shouldn't be spotted, you shouldn't even be bleeding, because the cervix is known to be closed during that course of pregnancy. Okay, so if you are having bleeding, it could lead to miscarriage. So, and it's not good. Another one is severe stomach ache. If you have severe stomach ache during pregnancy, you need to rush to the hospital or the nearest health center where you registered, because it could be ectopic pregnancy or preterm labor. Okay, and it's not good if you're having severe stomach ache. Another one is fainting attack. If you are going, just you are walking, and you're having just blood, or you feel as if you are fainting, it could be low blood pressure. So you need to go to the hospital and check yourself, because early identification and early treatment is very good to prevent child mortality and maternal mortality death. And it's very important. This is why many people die during pregnancy, or they say they just finished giving birth and they are dead. These are one of the things that causes it, because they don't go to hospital, you just take everything ordinarily. Please, we need to be cautious. Because pregnancy is not just what you just joke about. Another one now you should look after, or if it's happening to you, is high fever. If you're having high fever, hyperparesia during pregnancy, you check your temperature maybe 3, 4, 5 consecutive times, and this thing is high. Your temperature level is high, 38.5, 40. It could be sign of infection. Okay, and that one is reduced fetal movements. If you have reduced fetal movement, the baby is not moving as it's supposed to be. Meanwhile, in a day, the baby should be moving constantly, maybe like 4 to 5 times in a day, and you'd not even notice it. Maybe in a day, 2 days passes, you'd not even notice it. My sister, run to the hospital. There could be a problem. Run to the hospital. There could be a problem. Okay, and that one is severe nausea and vomiting. Nausea and vomiting, where you keep vomiting. If you just eat, you drink, the food doesn't even stay. You are vomiting. It can cause, it can make the amniotic fluid to reduce, and it can lead you to dehydration, which is very, very bad, and which is very bad for a woman that is pregnant. And that one is swelling in the face. Swelling, you may be having swelling in the face, swelling in the arms, swelling in the legs. Normally a pregnant woman in the later days, or maybe from 7, 8 nights, some people use from 6, 7, yes, it could be a complication. Maybe if the person is having a preeclampsia, maybe the person is getting towards that level. Maybe the person doesn't know, or especially all these women, some women don't even attend antenatal if they are pregnant, to discover all these things. You need to go in for your regular checkup. They will check your protein in urine, glucose in urine. So if you're having high protein in urine, it could cause preeclampsia. So if you notice that you're having puffy face, you're having swelling in the arms, swelling in the legs, like it's extreme, unlike how it's supposed to be, my sister, you need to rush to the hospital. Okay, and that one is severe. Maybe if you are feeling restless, you are feeling too much fatigue, tiredness, it could be a problem. So early identification and early treatment is very, very crucial. It's very, very necessary. Okay, I still remain your only one all-round Nurse Doris. Okay, please subscribe to my YouTube channel, subscribe to my TikTok and Facebook, all-round Doris.